Good evening, and it's great to have you with us here on another night of consequential news in this fight against the coronavirus. You will hear tonight from patients across this country, their symptoms, the doctors and nurses, what's being seen in the hospitals. And tonight in New York City, at least 13 patients dying from this at the same hospital. New York's governor saying today, given the numbers, given what they're seeing, they do not expect this to peak for about 3 weeks. And of course, this is one of the first hotspots in New York. Other communities will come next. Tonight, in just 1 week's time in this country, we've gone from 7,700 reported cases to more than 62,000. Nearly 900 people have died. At least 26 states have taken emergency measures to slow the spread. More than half of all Americans under those stay-at-home orders. New York State seeing an increase of 5,000 cases in just 24 hours, the majority in New York City. And tonight, as part of the emergency response, of course, the city is now preparing for the surge, the peak still weeks off, and preparing for the worst. This makeshift morgue going up outside Bellevue Hospital. Across the country tonight, reports testing is still hard to get. In many places, only the very ill, and reports of people waiting several days for results. The National Guard at this site in Chicago. And sailors on board the U.S. Navy hospital ship Mercy preparing to receive patients when they dock in Los Angeles in the coming days. Tonight, the symptoms from this, we hear from those patients across the country. The biggest stimulus bill ever. How much will checks be worth? Sent to millions of Americans, and how long will unemployment be extended? Again, we take you through this one step at a time, one day at a time, and Tom Yamas leads us off from New York tonight.
Tonight, a grim sign this pandemic is far from over. Teams setting up a makeshift morgue outside of New York's Bellevue Hospital, something they did during 9/11 and Hurricane Sandy. Overnight, at least 5,000 new cases in the state. At one hospital alone, 13 people dying in just 24 hours. The hospital saying the virus is taking a terrible toll. But tonight, one sliver of hope. Extreme social distancing measures may be working. The rate of hospitalization slowing slightly.
This is a very good sign and a positive sign. Again, I'm not 100% sure it holds or it's accurate, but the arrows are headed in the right direction.
But Governor Cuomo says we're still weeks away from hitting the peak in New York City, a scenario which could collide with the president's new timeline, proposing to ease restrictions by Easter Sunday. That's April 12th.
What a great timeline this would be. Easter as our timeline, what a great timeline.
But even the nation's top health experts recommending not committing to any date.
That's really very flexible. We just had a conversation with the president in the Oval Office talking about, you can look at a date, but you got to be very flexible. And on a literally day by day and week by week basis, you need to evaluate the feasibility of what you're trying to do.
New York, the epicenter in the U.S., still in need of more space and more supplies. 4 field hospitals underway and still a need for those critical life-saving devices, ventilators. The governor announcing 11,000 are on the way, but he needs a total of 30,000. Cuomo saying they may do what Italy did, split the ventilator. 1 device, 2 patients.
We're exploring splitting, where 1 ventilator could do 2 patients. Italy has had to do this because they were forced to do it.
Those ventilators desperately needed for patients like 25-year-old Jack Allard from New Jersey, who is in a medically induced coma.
This virus is really dangerous. He's very, very sick.
The former lacrosse player woke up with backaches and a fever nearly a week ago.
He never vaped. They were asking us that. He never vaped. He never smoked. I mean, he took his health very seriously. I mean, he's an athlete.
Jack's doctors now trying an experimental drug for Ebola, his family hoping it will save him. In New York City, 46% of coronavirus cases are people aged 18 to 44, the virus hitting all ages. 62% of deaths are men, and 54% of people who die from the virus are over 75. That's why in Woodbridge, New Jersey today, more than 90 residents had to be transferred from an outbreak inside this nursing home. And we're learning more about a Georgia hospital worker who died from the virus. A 42-year-old mother discovered in her home, her 4-year-old found alone during a welfare check. The U.S. Naval Hospital ship the Mercy heading towards Los Angeles today. The medical crew on board preparing beds and equipment to handle a surge of up to 1,000 patients offshore. And tonight, a new effort to help from North Carolina to Colorado. Veterinarians now donating medical equipment, including ventilators.
This is just one more example of the One Health and us being able to partner with our colleagues on the human side.
New hot zones now popping up across the country. Tonight, disaster declarations for Texas and Louisiana. In New Orleans, Mardi Gras, just weeks ago, a celebration with massive crowds and days of partying may be one reason the coronavirus is now spreading faster here than anywhere else on the planet.
My EMS department, over 50% of my people are now on quarantine. The state can no longer go on without without federal assistance at this time.
And the virus now taking its toll on first responders.
It's very personal. Each and every day I get a report and the numbers climb.
In New York, more than 200 members of the NYPD have been infected with the virus. In Detroit, at least 2 officers have died. And for the army of Americans working to keep up with a new surge in home deliveries, cases of the virus now reported in 9 Amazon warehouses.
This is really being felt across this country. Back with Tom Llamas tonight. And Tom, we saw the images of that temporary morgue you just reported on being set up outside the hospital you're live at tonight. And we, of course, want to reassure the audience this is still just as they prepare for the worst, knowing that this peak, as the governor said today, is still weeks off.
Yeah, we want to be very clear about this, David. This is only temporary, and they're doing this because there's a public health crisis and a state of emergency in New York. Right now, there are 5 morgues in the city of New York. None is at or near capacity, but again, they want to make sure they plan for the worst. And David, to give you an idea of the severity of the situation, one major hospital here in New York, Mount Sinai, sending a memo to all of its doctors and nurses saying this is the humanitarian mission of our lifetime. David?
Tom Llamas leading us off tonight. Tom, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.